And now I'd like to welcome Parker Chuong, who will share more about the broader implications of living with a genetic condition. As Lauren mentioned, Parker is a researcher who works with patients at the Royal Melbourne Hospital, and is also involved in research at the Centre for Eye Research Australia. So please welcome Parker.
Thanks for that, Harrison, for the introduction. Make sure. So, good morning, everyone, and thanks for joining me today and on a Saturday. I really appreciate that. So my name is Parker, and I'm a genetic counsellor. And today I'll be talking about the implications of a genetic condition. So things that may come up before and after genetic testing, and the decisions people face, and how a genetic diagnosis can affect a family. My goal is to show you how genetic counselling helps people make informed decisions and manage uncertainty and feel supported throughout the whole process. So I just wanted to start by giving you a bit of background about the genetic counselling profession because it's not very commonly known. So genetic counsellors are allied health professionals, and we have specialised training in both genetics and counselling. And currently there's only 2 universities in Australia that offer that training, one in Sydney and one in Melbourne. Most genetic counsellors work in public hospitals where there is a genetic service department and that department offers genetic testing. Usually there's genetic counsellors there. Sometimes we're embedded in research teams, like this research team where the study offers genetic testing. So I just want to highlight, as CC mentioned, genetic testing is not a straightforward medical test, and there's a lot to think about before and after the genetic testing. So if you're referred to a genetic service for genetic testing, there's a good chance you'll meet a genetic counsellor. Usually there's 2 main appointments. The first one, what we call the pre-test appointment, and this is where we discuss the genetic testing process and we get your consent for the actual testing itself. The second appointment, called the results appointment, which takes place around 3 months later, because that's how long the sequencing takes when the lab is doing those tests. So in a typical appointment, there are a few areas I will focus on. First one being, I discuss the inheritance and risk. So as Lauren mentioned earlier, there are over 400 genes associated with inherited retinal disease. And some conditions occur when a person inherits one genetic change from one parent, some where you need to inherit 2 non-working copies from both parents for the condition to occur. So I guess understanding this inheritance pattern provides insight into the likelihood if other family members would be affected. I discussed the potential benefits and limitations of genetic testing, and I'll go into more detail about this soon. Like I said, I support you in making an informed decision, and this is probably the most important part of the genetic counselling process, because if you do choose to go ahead with genetic testing, I want to make sure that you've had the opportunity to ask every question possible and that you know why you are proceeding with the genetic testing itself. I explain the genetic test results to you in a way that's easy to understand and what it means for you and your family. I provide emotional support and help you with adjustments. So it can be hard to hear that your condition may be slowly progressing and that other family members may be affected also because of your genetic test results. But of course, not everyone and not every appointment is emotionally heavily involved. Some people may have had the condition for years now and they're very well adjusted, and genetic testing is just more of a confirmation of their clinical diagnosis, and this is just about getting a genetic diagnosis. So when I say counselling, I don't just mean emotional support, it also covers that informed decision-making process. So what are some of the potential or personal benefits of genetic testing? So firstly, it can provide clarity and understanding. So another word that is often used is empowerment. And while that sounds a bit buzzwordy, what I mean by that is when a genetic cause is found, it provides evidence for that condition. And that brings a lot of sense of control and relief for a lot of people. Instead of a broad label like you have retinal dystrophy, we can say something like you have a change in the XYZ gene, which affects the retinal cells in this way. I remember seeing a woman, part of our research study, and she had genetic testing through us, and we found the genetic cause for her condition. It was a rare gene variant and more particularly common within an ancestry group. When I explained this to her, she mentioned her parents' country of origin, which matched that ancestry group. She seemed relieved by that information. And when I followed up with her a few days later to check in on how she's dealing with the new information, she said to me, "It's helped me in ways I didn't expect." And I think for her, having that specific knowledge can answer long-standing questions of what has caused her vision loss, because a lot of people go years and years wondering why it's happening to them. And that's the kind of clarity and empowerment I'm referring to when I mention those words. Another benefit is managing other health issues. So as Lauren said, a single gene can affect more than the eyes. So recently at the Royal Melbourne Hospital, I saw a gentleman with vision problems and we found a genetic cause, and that genetic cause was associated with Bardet-Biedl syndrome, meaning he's at increased risk of kidney and other health issues also. At the end of the appointment, I asked whether he would share his results with his children, as they might have inherited the condition also. He said no, because it would cause unnecessary stress and there's no treatment for vision loss. I shifted the focus to how kidney problems can be screened and managed, and that did change his perspective. Another benefit is that the results can inform other family members. If a variant is identified, relatives can choose to be tested to see if they carry the same genetic change, and this allows them to make their own informed consent about their health and their future. And lastly, another benefit is family planning. So knowing the genetic cause can help inform decisions about having children, and there are options available to reduce the chance of future generations inheriting the condition if that is something the couples want to explore. And I'll go into more details about this shortly, about the options in terms of family planning. So those are some of the potential benefits and reasons why someone might be motivated to get genetic testing. So, like I said, there are some limitations and reasons why someone might decide not to proceed with testing. One is life insurance. So in Australia, life insurance companies can currently ask if you ever had genetic testing and what your results are. If you take out a new life insurance policy, income protection, or disability cover after genetic testing. But there are situations where you don't have to disclose that to the life insurers, and there are situations where the life insurers are not allowed to ask those questions from you. And at the pre-test appointment, a genetic counsellor will go into detail with you those scenarios of when they shouldn't ask and when you shouldn't disclose that to life insurers. But the good news is it looks like the government will be placing a ban on life insurers from using that information to increase your premium or rejecting your application outright. So there's draft legislation that has come out, and I expect the ban to be in effect within the next 12 months. So another consideration is the emotional impact that comes with the genetic testing process before and after, like I said. So testing can bring up a range of emotions. So both so during the pre-test, some people feel anxious about whether their children or relatives might be affected. When results come back, there can be frustration or sadness if no genetic cause is found or uncertain result comes back and we don't know what that means at this stage. Or if you found out that you get a positive result, a genetic cause is found, the guilt of the results that comes with knowing that your children might inherit the condition also. So this is where a genetic counsellor can provide that support with a different range of emotions that do come up. So a few weeks ago, I saw a 60-year-old gentleman who had genetic testing and it revealed the cause for his vision loss. It turned out to be a dominant variant, so meaning each of his 2 adult children have a 50% risk of inheriting that variant. His children were 19 years old, 21 years old, and 21 years old. And because his parents were not alive, he didn't know if any of his parents had symptoms. So there was no family history there to suggest that there was an inherited cause. So he never perceived that kind of risk for his children because of that, none of that family history. And when I told him the result, he was very quiet after I disclosed the results. And I think it came from a place of shock, a place of guilt, and a place of uncertainty. And when I asked him if he would discuss testing with his children, similar to the other patient, he said no, because his vision loss symptoms started late and he didn't think there was a reason to tell them right now. And I said, that's fair enough. You know your family dynamics better than anyone else. You know how your son would react if you told him. You would know how your daughter react if you told her. And he agreed. I then explained that while his own symptoms started later, others with the same variants can be affected earlier. And that if his children did carry the variant, they could be eligible for gene-specific clinical trials in the future if it's relevant to them. And I also explained to him that his children, if they decide to have children themselves in the future, that there would be a chance that they would inherit that variant also. And there are reproductive options available to help prevent that if that's something they're interested in. He paused for a bit and he said, I didn't even think about that. And my aim wasn't to persuade him, but to make sure he was informed if he chose not to tell his children. And sometimes people need that time to process the unexpected result. And maybe he'll wait until his daughter settles into university a bit before he discloses that results to her and tell her about the risk to the daughter. And maybe he'll wait until his son just overcomes a bit of mental health challenges and in a good position before he discloses that results to him. So what I'm trying to get at is when families are involved, many things can come up because of the different dynamics that can happen. So as I mentioned earlier, knowing the genetic cause can inform decisions about having children, particularly for those who want to reduce the chance of their future children inheriting the condition. So there's something called prenatal genetic testing that's available. So testing either before a pregnancy or testing in the very early stages of pregnancy. There's something called reproductive carrier screening that can be done before a couple decides to start a family. This helps identify whether both parents are carriers of the conditions, in which case there's a chance a child could inherit the condition if both non-working copies of the genes are passed on at the same time. There's prenatal testing during early pregnancy, so this can be done before 18 weeks, which involves testing, a sample of the placenta, which is a temporary organ that provides nutrients to the baby that shares the same genetics as the baby. You can test the fluid outside the baby, which has the genetic material of the baby in that fluid, so you can test that. IVF is another option many people have heard about, where the egg and the sperm are brought together in the lab and allowed to fertilize, and you're screening the embryos to see which one has a gene variant and which one doesn't, and transferring the one without the variant back into the mother. And every couple is different with their own goals, beliefs, and timelines in terms of family planning. So it's important to weigh up the risks and benefits of each option. I think the key point I want to mention is that there are options available. IVF is one option. There are 5 other options, and a genetic counsellor will talk about each options with you in detail if family planning is something that is part of your life goals. I should also mention that when a genetic service receives a referral for genetic testing, and on that referral, it notes that a person is family planning, we prioritize those referrals and you are seen sooner than someone who is not family planning. So family planning doesn't necessarily mean you are planning to have children right now in the next few months. It could be a few years from now. And so I guess having that discussion now with a genetic service means you understand your options ahead of time and you'll be well prepared in the future when it's time to start planning that family. So that concludes my presentation, and I hope I gave you insight to why genetic counselling can play a big part of the genetic testing process from the beginning to the end, the different emotions that come up and the different things to think about that can come about because of a genetic test result in a genetic condition. I'm here all day, so please come and say hello to me. There's a poster about genetic testing on the back. I'll be standing next to it. So yeah, don't hesitate to ask any questions at all. Thank you. Yeah.